Hi, Steve. How are you? Nice you decided to. Good evening. I'd like to call a regular council meeting on Monday, March 23rd to order at 6 p.m. I'm Mayor McNeil Smith, colleagues on council. To my far left, Councillor Novick, Councillor O'Keefe, Councillor O'Toole. To my far right, Councillor Duck, Councillor Duncan, and Councillor Gurnett. Good evening to staff in attendance this evening. And I see we have a staff member online as well. We'll introduce staff as they introduce their reports or take questions this evening. And good evening to members of the public, both here in the chamber and to those who may be watching the webcast. I'd like to turn to respectfully acknowledge that we're holding our meeting in the traditional territory of the Saanich people, the Tsawout Nation, the Tsartlip Nation, the Pakwitchin Nation, and the Tseycum Nation and the Malahat Nation. And we express our gratitude to the Saanich people for their stewardship of these lands for millennia, that is thousands of years, and appreciate their vital connection remains to the land today. In turning to approval of the agenda, since it was published last Thursday, we have one addition and one change. The addition is an item of correspondence from Jocelyn Gifford regarding the All Bay Road development variance application. That will go under 9A. And the one change that we have is Councillor Gurnett has requested raising item 15.2, which is three emails of correspondence regarding a development at 2400 Lovell Avenue. That will become item 14B. And with that addition and change, I'd look for a motion to approve the agenda as amended. Moved by Councillors Duck and Novick. Any discussion? Seeing none, those in favor? That carries unanimous. Thank you. And we're turning to, we have two sets of minutes to adopt this evening. The first from our regular council meeting of March 9th and the second from our special council budget meeting of March 16th. If I get a motion to receive, motion to adopt those, Councillors Duck and Novick again, thank you. Any corrections to either of those minutes? Councillor Gurnett, please.
Yeah, thank you, Mayor. On the meeting from March 9th under 4A, page 3 of the 5 under resolution 2026.13.113, and that's under speed limit adjustments R5, R6, and R8. And this is because we did get a letter on our Facebook page or a note from a member of the community who lives on this particular street. Northbrook Drive between Westbrook and Eastbrook. It actually is Westbrook, not Westbrook. So with the T, just to make sure everything lines up. Thank you.
Thank you, Councillor Gurnett. And with that correction, I'll call the question. Those in favor? That carries unanimous. Thank you. And so we're next turning to Rise and Report. And so at our regular council closed in camera meeting of March 9th, we considered citizen appointments to the Saanich Peninsula Accessibility Advisory Committee. And this following motion was passed. This is for information that Richard Welland be appointed to the Saanich Peninsula Accessibility Advisory Committee for a 2-year term, 2026-2027. So I want to thank Mr. Welland for expressing interest and committing to this citizen appointment on this committee. And pleased to also share that there are members, citizen members from North Saanich and Central Saanich also coming on to that committee again for the next 2 years. Our next item of business is public participation, where we open the floor, as it were, to invite members of the public to come forward to speak to council on a matter on the agenda or otherwise. We ask that you speak for up to 4 minutes, provide your name, the municipality that you reside in or the association you represent, and I'll call for a first time anyone wishing to come forward to the mic to address council this evening. We don't have anybody online. I'll call for a second time. Please come forward. There's just a little button at the bottom of to make the mic live.
Thank you. I learned that last time. My name is Rob Simon. I'm from Sydney. I'm actually here to again talk about the development at 9942. I'm beside 9942 3rd Street. That's the apartment building, the 4-story that's brought forward by High Point Property Development. Again, I have concerns about the cherry tree and how it just seems to be a gap in the conversations that are happening. I know for a fact that I've raised it before at a presentation that the driveway that's 0 inches away from our property line has protected cherry trees. The driveway, as it goes down to the underground parking, would sever the root system for those cherry trees. When I listened to the last presentation by the developer to council, councillor actually asked staff, would there be a deposit on those trees obtained from the developer to protect the trees? The answer was no, because those trees were not on the property under development. So to me, it became obvious that maybe the deposit wasn't needed because the root system would be protected anyways. That should be implied with the actual tree protection bylaw, but I still feel as though they're vulnerable. The whole conversation has been around those cypress trees on 4th Street, and I think it's sort of ironic that I'm here trying to defend ones that are on my property, in the strata property, that are protected, and yet are completely threatened by a building that foundation continues over to our property line. Maybe it's at ground level, but it's obviously part of the building. So I researched this more. I realized that, wow, there are other ways to potentially narrow the driveway. So I just want to also raise the fact that there are automated traffic control systems that will notice a car coming from either inside the parkade or from on top, or even mirrors. Maybe they don't have to go all the way to the property line. Maybe they only need a 1-lane entry to the actual parkade. I do want to point out the developer's traffic study said there'd be minimal impact on traffic around the building. So I don't see how that driveway could also be a high traffic area. Otherwise, I would contradict that report. And again, the arborist has ignored those particular trees. So I just wanted to raise those points again. And I'm sorry about coming back about this. I find that the process is more designed for the developer to communicate with council, potentially with the advisory committee. And for me, this is the only way I can either email or come to you directly so I can bring home the point. So respectfully, I say thank you for your time. And I'm sorry if you are getting tired about me talking about the cherry trees. Thank you.
Well, first of all, thanks for coming forward. Don't apologize for coming forward. It registers when we hear from members of the public, and be rest assured that after the Advisory Planning Commission reviews the application and forwards the recommendations to council, council will look to be speaking to all of the community concerns with regards to the project. You're welcome. I'll call for a third and last time. Anyone wishing to come forward? Not seeing any, I'll close public participation. Thank you. And we're next turning to our presentation this evening, and it's my pleasure to introduce MLA Rob Bottrell, Executive Director of Shoreline Medical Clinic Leslie Keenan, and Medical Director Dr. Chris Dowler to present this evening. I believe you understand you have 10 minutes for your presentation. And we'd appreciate it if you would take any questions we might have after the presentation. So.
I'll begin. Thank you so much for the opportunity to make a presentation this evening. As MLA, when I was running for office, I kept knocking on doors in Sydney and North Saanich and Central Saanich, and asking folks if they had a doctor. And I ran into an awful lot of folks that didn't have a doctor. And after certainly something that I really am focusing on as a priority as MLA, and you know, Shoreline has such a great reputation that when I heard that Shoreline was looking at a 3rd clinic on the peninsula, I thought I'm going to do anything I can to support their work. So I'd like to turn it over to the brain trust of Shoreline Clinic, and you know, hopefully we can get the 3rd clinic going on the peninsula, so the 15 or 16,000 residents that don't have a doctor or a nurse practitioner will. Thanks.
Thank you. Good evening.
Okay, so good evening, Mayor and Council. Thank you very much for having us this evening. I'm joined by Rob Bottrell, as you just met, as well as Leslie Keenan to my left. My name is Dr. Chris Dowler. I'm a family doctor in Sydney. I've worked out of the Shoreline Clinic since its inception in 2016. I'm also one of the doctors that work at the hospital down the road, and I'm very passionate about primary care and solving this big problem in our community. Maybe we'll backtrack. Has anybody seen the movie Project Hail Mary yet? It's in theaters as we speak. Yes? Okay, great. Has anybody seen Interstellar? Okay, there we go. So in these films, there's an existential crisis. There is a massive problem that affects everybody on Earth, or everybody in the community, so to speak, and there is no way to solve this problem. And people come together, the community comes together, they put their minds together and try to solve the problem. And I see a lot of parallels with Shoreline. I saw the movie this afternoon, and I wanted to bring that up. I'll start my presentation with that. Just scroll up, I think. Well, I have it on my phone here. I have it on my phone. There we go. Okay. So there we go, right? And so, yes, we're here today to propose a partnership among the municipalities on the Saanich Peninsula to support a third primary care clinic, or Project Peninsula Hail Mary, so to speak. So next slide, please. So who are we? We are a charitable nonprofit organization that opened its doors in 2016, but there was about a decade of work that went into starting Shoreline even before we opened our doors. Currently, we are comprised of 23 family physicians, two nurse practitioners, three specialists actually, since this presentation was created, and a full complement of an allied healthcare team. We operate out of two large primary care clinics, one located right here in Sydney, where I work, and the other located in Brentwood Bay. Out of the Sydney clinic, we operate the Saanich Peninsula Youth Clinic, which you may have heard of. Collectively, all of our providers service at least 16,000 patients. I know that number is higher now since we've been attaching. And we provide roughly 7,000 encounters per month. Our problem is that, as Rob mentioned, there are roughly 15,000 people on the peninsula who still don't have a primary care provider despite our best efforts, and we are very near capacity. And so we need to expand if we're actually going to solve this existential problem for our community and bring these people in from the cold. We, in addition to providing primary care, which is going to see a family doctor or nurse practitioner, we also provide maternity care services. We have the only two maternity care providers on the Saanich Peninsula operating out of the Sydney clinic. We also provide a huge amount of support to the Saanich Peninsula Hospital. 50% of the staffing on the ward. So if you get admitted to the ward and you're sick enough to go through emerge onto the ward, there's a 50% chance that a Shoreline medical doctor will be looking after you. We also provide a large percentage of care to all the long-term care patients on the Saanich Peninsula. We also support urgent care and also palliative care services. So long story short, we are essential to all facets of care on the Saanich Peninsula, not just primary care. It's very important to note that we are governed by a volunteer board that's comprised of community members with special skills and attributes, and as well as local healthcare providers. And we come together and we try to solve this big giant problem that faces our community. So next slide, please. So what is our challenge? Roughly 20% of the peninsula does not have a primary care provider right now. Furthermore, our acute care services are vastly overstretched. Since 2021, ER visits have gone up by 25% on a daily basis, averaged out. Furthermore, there continue to be gaps in mental health and substance use, that's MHSU, maternity care services, seniors care, youth care, and there's a significant lack of local specialists. So even if you do have a family doctor and you might need to see a cardiologist or a surgeon or something, sometimes that barrier of having to drive all the way into Victoria, that's just too far for some people, and they can't get services they need because they're not local. So having a clinic locally would help to recruit some specialists as well. And we continue to have an aging population. I know I don't need to tell you guys that. Next slide, please. So this is an example of a Shoreline Medical patient panel. It's here to show you that we selectively attach patients, or the vast majority of patients, from our region, from the Saanich Peninsula. So we are trying to solve our local problem as best we can. This is actually my family practice. When I first started, all my patients were located within the drawn borders there, but over time people move and migrate, just like as life happens. But you can still see the vast majority of my patient panel is on the Saanich Peninsula. Next slide, sorry. Thanks. And thank you very much for the loan in 2016 to help us get off the ground. Thank you.
Thanks, Chris. The aim of what it is that we're trying to do is to actually locate a third clinic somewhere central on the Saanich Peninsula. We've got one in Brentwood and one in Sydney. And when Central Saanich first approached us, the mayor and council, to talk to us about proposing a third clinic on their site, it was with that, the data, and our board saying, we don't feel like our job is done until every resident on the Saanich Peninsula has a family doctor or a nurse practitioner. So we're thinking somewhere central. It would continue to be team-based care, which is what we have now. So we have nurses, social workers, mental health counselors, and pharmacists as part of our team, social workers. And one of the additional things that we would like to put into a third clinic is a dietitian because of the elderly population, as well as some outreach workers for our youth clinic to be able to connect with the different middle and secondary schools in the area. We proposed that it would continue to be governed by the Shoreline Medical Society, so that's the volunteer board that Chris mentioned, and we'd also like to have a municipal standing committee, and that municipal standing committee would not be just in Central Saanich. It would be all of the municipalities on the Saanich Peninsula who want to participate in this endeavor, because we'd like to hear from you what's happening with your constituents, and we'd like to be able to report back what's happening with the new clinic. We'd also like to provide ancillary services. So, when you go to your physician or your nurse practitioner, how wonderful it would be to be able to walk down the hall and get your blood drawn or get your imaging, your x-ray or imaging done, rather than having to go to San Pen or go downtown to Victoria. And as Chris mentioned, we'd also like to bring specialists into this third clinic, very specific given our demographic population. Next slide, please. So this was our ask to Central Saanich in last fall when they invited us down to do a presentation. And you're probably aware that they are going to raise the current municipal hall and redevelop that into a mixed use space. And that's the space that they had under consideration for us. What we asked for was a long-term lease with a very nominal fee, lease rate on return. We saw that as a low risk for the municipality because it would be Shoreline that continues to operate it. We'd be the people that would be staffing it. We'd be the people that would be carrying the liability. And it is something that we feel has got high community impact, because for every dollar that's invested locally, we will be able to leverage funding from elsewhere, hopefully the province. And what's happening right now is Central Saanich is exploring through public input into what they'd like to see in this space, and Shoreline is currently undergoing a feasibility study. Next slide, please. So this should be the benefits to Sydney instead of the ask of Sydney. But basically what we're saying is that municipalities, whether you're directly involved in Central Saanich or the bordering municipalities, can be enablers of equitable care to citizens that benefit both the region and the constituents. So what we hope to do through this work is to have improved access, obviously, to primary care, to strengthen regional collaboration in healthcare services, and it's one of the asks that we have of each municipality that I'll get to in a minute. We're hoping that more primary care will be able to reduce the strain on our Sanpen Hospital Emergency Department, but also the other two hospitals downtown. There are economic and social benefits for Sydney when you think about the workforce that would be moving to the peninsula. And there's regional health equity and inclusion. So what we're looking at is everyone that doesn't have a family doctor, whether you're in Sydney, you're living on one of the First Nations, you're a newcomer to Canada, we want to be able to embrace the whole group. And then finally, to be able to leverage external funding and resources. Next slide, please. I'm not going to go through all of these slides. There's a few, there's about 3 slides here that suggest how Sydney could help. But there's 2 things that I want to focus on because I know we are short of time and I want to be able to open it to questions to you. One is that as a municipality, there's a lot of strength in advocating for expansion of primary care, not just locally, but in a coordinated regional fashion with the CRD. And the other ask is that if you consider down the line, if this comes to fruition, this clinic, is to think forward in your budgets about it may not be, the construction shell that we're offered, but we will have to make tenant improvements in there, putting in equipment, office, furniture, and the like. And so you may want to consider at some point in time to think about seed capital, a contribution of seed capital. And I'd like to leave it there. You have the rest of the slides, but would like happily open it up to questions.
Well, thank you very much for the presentations, and I'll turn it to colleagues if there are any questions. Don't be shy. Councillor O'Keefe?
Thank you for the presentation, and I think you bring up lots of good points. It's it's something we hear from our residents as well, the need for additional health care. And actually, members of this council, myself, and I think maybe one other, participated in a workshop with included doctors, a number of stakeholders in the region in terms of ways that local governments could support clinics. So there's some good information came from that. What I'm wondering, one of the things I'm wondering is, are you looking to? It looks like you've got your focus set on a new clinic in Central Saanich. Are you looking to expand in Sydney as well, or?
The space that we have in Sydney right now is 10,000 square feet, including the pharmacy that's there. So we've got just over about 8,400 for the clinic itself. And as Chris said, we're at capacity. We can't take any more on in that space. It's just not manageable. And the Central Saanich was, as I mentioned earlier, was something on invitation from Ryan Windsor to come and speak to Mayor and Council. And it's still early days. I mean, Municipal Hall is still there. And it was with their encouragement that we did the presentation, but no one can see the future, in terms of what the next 3 years can provide. What we want to do is we want to continue with our mission, which is to provide primary care to every resident on the peninsula that doesn't currently have one. So umbrella, if you look at it that way, maybe in Central Saanich, maybe somewhere else.
Yeah.
I understand you're developing your municipal hall.
Right, and so one of the things that came up in these discussions we had at UVic, and I think that was last year, was that you know, municipalities, although we hear that there's need for space, didn't really have concept of how much space, you know, and so that's one thing in terms of getting the medical community to say, hey, if you're putting up a new building, here's a number of people in your community that need a doctor, here's the amount of space that we would need for that, so that's something that would be useful.
So if you, I can answer that question
okay.
actually. So if you think about our current space, there's currently about 15,000, between 14,500 and 15,000 people without a physician, and each physician will take on about 800 to 900. So you're looking at about 14 and a half physicians, which would be similar to the space we've got now.
Okay, so you need double the space you have now,
Yeah,
right, okay.
yeah.
The other thing that came up is, there's an organization, I don't know if is it the South Island Division of Family Practices that is out recruiting, and the province is recruiting, so,
South Island Division of Family Practice.
right, okay.
Yeah.
And so I'm wondering, if you had the space, are you connecting with them in
Oh,
terms
yes.
of, would there be,
Yeah.
if we offer another 10,000 square foot space, have you got the doctors to fill that?
We would have to recruit the physicians to come. One of the things that we didn't get into, because it's in a longer presentation, but the reason that physicians and nurse practitioners want to practice at Shoreline is because we do everything we can to take the administrative burden off. And so just even today, I got an email from a physician at the hospital who wants to provide locum support at Shoreline because she hears from the Shoreline physician and the locums what a smooth operation it is. And that's one of the very strong reasons why we're able to attract.
Yeah, right. Okay, that's good for me for now. Thank you.
Thank you. In speaking order, I have Councillors Rintoul, Garnett, and Duck.
Thank you, Mayor. Thank you for the presentation. I learned something. I've been sitting here in my life thinking the problem was we can't attract doctors. I didn't realize it was a challenge to get space or facility, and that's troubling because I would have thought that should be the easy fix. So thank you for coming forward and making a specific ask, and you spoke to two items around advocacy and perhaps capital support in time, and certainly from my perspective, that's something the municipality should support. At the same point, acknowledging that the province obviously in healthcare has a role. So I'm assuming you, to what degree you can have advocated to the province.
That's why Rob's here.
Yeah. I noticed Rob was here, and I heard his words, but I'm pleased that we've got our MLA's support and taking this in the forefront. I may have lost touch with what Saanich Peninsula Hospital and Healthcare Foundation does in terms of all of its encompassed roles, but I had thought years ago they switched part of their focus to be towards the healthcare component as opposed to just the hospital. So do you continue to work with the foundation?
The foundation has provided up to $4 million since 2016 for Shoreline. And as of the end of this month, so in 2 weeks, they're moving on to other priorities. So we'll no longer be receiving any funds through the foundation.
And were those funds operational in nature? Were they for capital projects?
Both. Yeah. So when the Sydney clinic expanded, and Chris spoke to the loan that Sydney provided, that was at the same time that we were getting set up as a charity, and we couldn't accept money. Foundation couldn't give us money as a charity until we were a charity. And so the town council kind of, stepped in and helped us out there. But then following our charitable status, the foundation provided funding both for capital and for operations.
And has your board contemplated moving into that space, either through a separate foundation or an entity? And my comment is around fundraising for capital.
Yeah.
This is a very generous community, and healthcare and access to physicians is very important to this community. And I expect if you've got a shortfall from the absence of the Saanich Municipal Hospital Foundation, just as they've moved on to focus on their projects, which makes sense, that there may be capacity in this community to support another
Yeah.
foundation. So have you looked at that?
Yeah, we actually started our own fundraising efforts because we knew this was coming. And our most recent campaign started at the end of November. Our goal was to raise $500,000. We still have about 3 weeks left, and we're 90% there. And that's just a general kind of fundraising for the youth clinic, physician recruitment, that kind of thing. If we were to focus a campaign on a new clinic, I think you could see a lot of people stepping up for something like that.
I think you're absolutely right. I would encourage you to do that again. And I know it's a very generous community, and this is important to the community and the municipality. So thanks for coming forward. Appreciate it.
Thank you.
Thanks, Councillor O'Toole. Councillor Gurnett.
Thank you, Mayor. Thank you for the presentation. Thanks for all three for being here. You mentioned the loan. I asked staff earlier today because I remember that $192,000 loan that's been paid back. 2014, 2018 council gets credit for that. I was not a part of it, but it was one of the great things they did. When that request came forward, was there a request to the other two Peninsula municipalities for any kind of funding, or was it just to Sydney, and was Sydney the only one
At
that
that
provided
time,
it?
I believe it was just Sydney.
It was just Sydney at the time.
Okay.
Yeah.
Right.
At that time, we were only located in Sydney. The Brentwood Bay Clinic hadn't opened up yet,
Right.
and we were largely attaching from the Sydney community anyways.
Thank you. With regard to the capital or seed funding contribution, obviously you wouldn't have a number at this point in time. It's early in the process. But I am curious as to the timing of this presentation, given that this is an election year and you could have a very different council a year from now, and you may need to come back again because they may not be up to date on everything that you've discussed this evening. So was there any thought to delaying it based on given the election year or not?
There hasn't been, only in the sense of what you've just said, that the cycle repeats itself over and over and over again.
Yeah.
And when Central Saanich is talking about, raising their municipal hall, I'm thinking that's easily 3 years out. So right now, we're kind of, getting some motivation going and some interest and kind of keeping it alive.
Perfect. Thank you. And just a couple of questions more, if I may. With regard to staff time, so I've checked in with staff today, and our staff is very busy. They don't have a lot of capacity, and of course this would be something in the future, but what do you perceive as when you're asking for provide staff time? Like what would that look like in terms of what demands would be placed
So
on?
in the on the slide itself, when it's asking for staff time, that was specific to things that we could use help with now. So example would be the feasibility study. We're kind of doing it off the side of our desk. Be great if we had someone with expertise to be able to help us with that. In terms of long-term staff time, I don't see that it would represent much for Sydney. It would be more along the lines of if municipal councillors wanted to become part of a municipal standing committee to advise into this clinic.
Okay. And you've touched on the standing committee and councillors. What would you foresee in terms of that role, in terms of meetings and what parameters might be around it, given that you're likely to have somebody on a council that doesn't have your great expertise in the area? So,
yeah, so it would be, the role would be more about what are your constituents saying to you, and then we would be kind of the intermediary. We could then report back to you what our activities are doing, but it's a way to stay informed.
okay, great. Thank you very much. Thank you, Mayor.
Thank you, Councillor. Councillor Duck, please.
Thank you, Mayor. Thank you for your presentation and very valuable information and a very important service on our peninsula here. You mentioned in the first clinic that was put in Sydney, the $192,000 was given by the town of Sydney as a loan, and subsequently put up a clinic in Brentwood. What was the municipal participation in each of the development of those first two clinics?
In Sydney, it was a fantastic way forward, because I'm not sure, we were at the time, I wasn't even with Shoreline then, but I've heard the stories, and it was a deadline. We needed to be able to expand. We didn't have the money. We hadn't yet received our charitable status, so this was the way out. And it wasn't just a financial contribution. Shoreline really saw that as the strength of the municipality standing beside us, understanding what an important project this was.
So yeah, so by extension, did you get similar support from Central Saanich and North Saanich in regards to either this clinic in Sydney or Brentwood Bay?
Brentwood, I can't speak to.
No.
Yeah,
Okay.
there you go.
So
No.
sadly, we're the only municipalities that stepped up to support you in your endeavors to grow. And so
In this way,
I hope
yes.
that our colleagues in North Saanich and Central Saanich take note, and maybe they'll be more endearing to you. The other question, you brought up the South Island Family Practice.
Mm-hmm.
Are you doing any cooperative work with them in the development of a clinic and
Yes.
housing at Saanich Peninsula Hospital?
Housing at Saanich
So
Peninsula?
I know there's a project in the drawing books to put new clinic services and housing for
Oh, yeah.
medical staff at Saanich Peninsula Hospital.
Yeah, we haven't been involved in that at
Okay.
all, no.
You may want
No.
to keep your finger on the pulse with that with South Island Family, because that may be where the clinic ends
So
up.
I can tell you what we're doing with the South Island Division right now as part of our feasibility study is we've asked the Primary Care Network Steering Committee to pull together the physicians and nurse practitioners on the Saanich Peninsula so that we can establish exactly how many patients are on the Health Connect registry, how many do they anticipate are not, how many clinics are intending on expanding and to what point, and also how many physicians are up and coming for retirement, so we can get a much better snapshot of what the true picture is than us in our tiny little corner. And the other place that we partner with the division on quite strongly is the physician recruitment lead, Nikki Bouchard.
So yeah,
Yeah.
just to say that they are I know that South Island and VIHA are working on a project potentially for the Saanich Peninsula property that includes a clinic and housing for medical staff. And that's one of the, as one of my colleagues pointed out, is housing might have been the issue, but also just having that clinic maybe in that area as well.
Yeah, thank you for that.
Okay, thank you. Thank you, Mayor.
Thank you, Councillor Duck. I'll have Councillor Novick and Councillor Duncan, then myself.
Thank you, Mayor, and thank you for your presentation. I love Shoreline. I've been a patient for years, and I think you guys do great work. I like your multidisciplinary approach to medicine, and I would love to see you continue to grow. I have a couple of questions, mostly about the location. Maybe I didn't understand the presentation correctly. Are you looking for your third location to be in Sydney or in Central Saanich?
Central Saanich.
Definitely Central Saanich.
Well, that's what we've been offered, and it's not even, there's no contract in place, there's no timelines in place. We were asked to speak to it because the mayor knew the building was going down, they needed another healthcare clinic, and they asked us to come and present from a Shoreline perspective.
Okay. And is expansion of the Sydney location at all feasible, or?
We take up the entire building already.
Okay. Well, you could go up as well.
There's lawyers up there, I'm not fighting with those guys.
Lawyers can move. Lawyers are flexible. Okay, that's great. And have Central Saanich offered you any financial support
Not yet.
other than
No.
the? And are they prepared to fund, or as you suggest, to provide a low dollar lease
Not
back
yet.
on that?
We've asked for that, but
You
no
have
formal
no
agreement in
commitment
place,
at all
no.
for that?
no.
Okay.
Yeah.
Okay. Thank you very much. And
Thank you,
Mayor.
Councillor. Councillor Duncan, please.
Yeah, thank you. I really love what Shoreline does with the integrated model, right? Having all of the different professionals kind of in the one-stop shop, because I know from having friends who are social workers and from my own experience that making sure there's no gap in that means that you're getting the right medication in the right amount at the right time, and because health problems can cascade if that's not happening.
That's right.
So that's a big part of it. And you've made a good case, and I think people understand, emotionally, if they've been in that position before, that that's a good model. But from the perspective of knowing the provincial government has, this budget deficit, and municipal governments are being kind of grilled on our percentage tax increases, is there a way you can quantify how having this care model has been something that actually also saves taxpayer money? And so the little bit we put in really actually ends up saving money in the long run, because when people are all get this care very promptly and with all these professionals together, it, minimizes the time people actually do spend in the healthcare system.
I think a very simplified way to look at that would be, if you don't have primary care, if you don't have good primary care, accessible primary care, your health outcomes are going to be a lot worse. And those health outcomes are costly on the system. They're costly for things like hospitals, urgent primary care centers, but they're also costly in the more sort of what you would classify as social determinants of health: food, income, education, housing. All of those things affect healthcare outcomes. So if you don't have good healthcare, those other areas are also going to be affected.
Do they have a dollar figure?
I don't have a
You
dollar
don't.
figure.
I'm just thinking of the example because you do.
Do you
Because
have-
Dr.
Yeah,
Dowler.
Come on,
Yeah.
come on up. Yeah.
So at Shoreline, we were constantly doing quality improvement projects. We were looking internally and trying to look at our operations and find ways to do things better, to make the patient experience better. And so we can improve the quality of care, improve access to care, so how quickly you can actually see somebody to have your needs met. And that's something that we're really focusing on right now, given the challenges that the hospital and other levels of healthcare are currently facing. So one of the projects that we've been working on over the last couple of years is our rapid access project, or basically how quickly patients can get in to see us, and what can we do to improve that. And we made some changes over the last year and a half or so, 2 years maybe, and we've been tracking our patient visits to Saanich Peninsula Hospital emerge. And what we have seen over this time span, and we get reports every month, is that the numbers keep going up for almost all family practices around the region. Whereas since we made our operational changes, our numbers have stayed the same, if not gone down. I can't quantify exactly. I know that every time somebody goes to the emergency department, it costs the taxpayer $1,500. I can tell you that. I can tell you that every day that somebody's admitted to the ward, many admissions, by the way, can be prevented if you have access to your primary care provider and have the infection treated right away, or whatever the problem is, treated right away. $1,000 a day to the taxpayer, plus physician services, whatever that costs the taxpayer every day. So every time we can prevent somebody from going to access care at Emerge and needing to stay longer if they're that sick, is money saved for the taxpayer. So I think I can't tell you a number, but it's made a difference, and we do have data to show that what we have done internally has made a big impact just down the road. Thanks.
Okay.
Thanks, Councillor Duncan. And I just have a couple of questions, just expanding on some of the other ones that have come forward. You talked about existing capacity, and I guess it's in two ways. One is the space that you have. So you indicated you're at capacity space-wise at Shoreline in Sydney. Similarly in Brentwood?
Yes, both are maxed out.
And what's the square footage?
Square footage in
Brentwood?
Brentwood is just over 2,400 square feet, and the square footage in Sydney without the pharmacy is about 8,200 square feet.
Okay. And do you have the capacity to add additional physicians at either clinic presently?
No,
So
we're
you're at 23.
literally we're at the we're at the edge.
at the seat.
Yeah.
So in terms of when you say doubling the size, you're referring to doubling the size of the combined 8,400 square feet and 2,400
Yeah,
square
be
feet.
about 10,000 square feet all told, and that would bring primary care, pharmacy, the specialist services, and hopefully lab and imaging.
Thank you. And in terms of the feasibility study that you referenced, is it business case as well, in the sense that it will determine your space requirements?
Eventually, yes.
What costs you would expect to
Yeah.
to anticipate?
So the phase that we're at right now is it's just in draft form, and we have 2 outside experts that have been willing to take a look at it. Once it's beyond draft form, one of them is construction developer who used to be on our board many years ago, and someone else is an executive director who has opened a number of clinics. We want those external eyes on the feasibility study, make sure we're heading in the right direction.
And so the next step after, when do you anticipate the feasibility study being completed?
Probably April, May, probably in May.
And what do you see steps following the release of the receipt of that?
Following those steps, we will be able to determine, are we going to go forward or are we not? And if we are going to go forward, then our first job would be going back to the municipality. And it depends a little bit on what happens with the work with the South Island Division. That's why I'm saying April, May, because they're the ones that the Primary Care Network Steering Committee would be in charge of that meeting of gathering the physicians and nurse practitioners on the peninsula, which is a little bit out of our control.
Right. And you mentioned the $500,000 campaign underway now, nearing completion, and congratulations on the success
Thank
of
you.
that to date. Is part of that allocated to future capital, or is it all operating?
It's for physician recruitment and retention, staff recruitment and retention. We also use it for some capital expenses, like that we need to do some renovations in Sydney and in Brentwood. And we hadn't set out with the $500,000 being part of the clinic. That would be a brand new campaign. But of course, if there's money left, yeah, it would go towards that.
Understandable. You'll want to wait to receive the feasibility study and
Yeah.
and have a go, and then be able to initiate a new capital campaign, which would be on top of what you foresee the need. I mean, if you have a $500K campaign, for this 6 months, do you foresee the ongoing need for that in physician recruitment? And
It depends. It depends on, so we're looking at our fundraising campaign now, which is all reliant on external donations. And so what we're looking at right now is, could we flip that on its head and do that as an internal business proposition, sort of like social enterprise kind of idea, to help raise the funds that we need for the to provide the charitable services. So we're exploring some avenues right now around that.
Okay, thank you. My last question, you made brief reference to the CRD, and we know there's a Capital Regional Hospital District, and the main board is also the board of the hospital district, so I serve on that. And the CRD as a regional district contributes to VHA, to Vancouver Island Health, approved capital projects, a certain percentage. But those facilities have to be designated healthcare facilities.
That's right.
Are shoreline clinics designated healthcare
Not
facilities?
under the health authority, they're not. They're not health authority property, owned or operated, yeah. The affiliation with Island Health is through the primary care network, so the team-based care that I mentioned, that's through the health authority. So those are all health authority employees.
Okay, so there's no opportunity for funding as a designated health facility through the CRD hospital
I
district?
don't think so, no.
Funny, yeah, I thought
No.
so, but I just wanted to.
Yeah, and the reason I mentioned the CRD, Cliff, is because just as I think it was you that mentioned it earlier, it's sort of, you've got municipalities working on their own, but wouldn't it be wonderful if there was some kind of regional collaboration to look after the primary care needs of the peninsula? That's kind of what we're getting at.
No, fair enough. Well, thank you very much.
Thank you very much.
For all three, for your presenting and attending this evening, and we certainly wish you well
Thank you.
in
Thanks
your
very
endeavors.
much.
Thank you.
Yeah.
So we're next turning to bylaws. We have 5 this evening. The first under 8A is a collection and disposal of refuse amendment bylaw. I'll turn to Mr. Hissick for an introduction, please.
Thank you, Mr. Mayor. The minor rate increases are required to keep up with costs in our collection contract and in landfill tipping fees. Increases are in the range of 75 cents to $2 per quarter, depending on the type of account.
Thank you. Are there any questions from colleagues? We can proceed with 3 separate readings. Councillor Duck, please.
I move the bylaw be given first reading.
Second.
All in favor? Carries unanimous.
I move the bylaw be given second reading.
Second.
We have the same movers. This is the discussion level. Any discussion? Seeing none, those in favor? Thank you.
I move the bylaw be given third reading.
Second.
Moved in same seconder. All in favor? That carries unanimous. That'll come forward to a future meeting for adoption. The next 4 bylaws are water utility and sewer utility that arise from us approving the 2026 to 2030 capital plan. Mr. Hissick, did you wish to add anything further?
Just a very quick reminder that for water, there's a slight increase to the variable charge to keep up with bulk water costs. And on the sewer side, the recommendations from the recently approved rate structure review are simply being put into place. And the goals of both these rate structures are to make and keep each utility sustainable. Thank you.
Thank you. And if someone could take us through the bylaws. So we're going to have 3 readings for each of these 4 bylaws. Councillor Duck.
Yeah, I would like to, bylaw number 2308, water utility rates and charges, amendment number 5, that the bylaw be given first reading.
Second.
All in favor? Carries unanimous.
That the bylaw be given second reading.
Second.
Any discussion? Seeing none, all in favor? Carries unanimous.
And that the bylaw be given third reading.
Second.
All in favor? Carries unanimous, and that will come forward to a future meeting for adoption. 8C, please, Councillor.
Yes, I'd like to move bylaw number 2309, water parcel tax amendment number 1, be given first reading.
Second.
All in favor? Carries unanimous, thank you.
The bylaw be given second reading.
Second.
Any discussion? Seeing none, those in favor? That carries unanimous, thank you.
And the bylaw be given third reading.
Second.
All in favor? Carries unanimous, thank you. That will come forward, likely with the others, for adoption.
And
Councillor?
I move bylaw number 2310, sewer utility rates and charges, be given first reading.
Second.
All in favor? Thank you.
That the bylaw be given second reading.
Second.
Any discussion? Seeing none, all in favor? So it's discussion, go ahead.
I just want to commend staff for bringing this forward and the new structure. I think it makes sense to align it with the water utilities as well. So I'm glad to see this come forward, and I think it'll balance out rather well. So thank you to staff.
No further discussion, all in favor? Carries unanimous, thank you.
And the bylaw will be given third reading.
Second.
All in favor? And that carries.
And finally, bylaw number 2311, sewer parcel tax. The bylaw be given first reading.
Second.
All in favor? Carries.
And the bylaw be given second reading.
Second.
Any discussion? Seeing none, all in favor? Thank you.
And the
Carries.
bylaw given third
Second.
reading.
All in favor? And carries unanimous, and that passes. Thank you, Councillor Duck, for taking us through those. We're now under 9A, which is the development variance permit application number DV 100388 at 10437 All Bay Road. This has come to us at previous meetings. We had a notice sent out. We've received 1 submission that is part of the agenda package. We received a second submission from Ms. Gifford as an addition to our agenda. And we have a recommendation. We can just read the recommendation if you so move. Councillor Duff?
I so move that the application be approved.
Second.
Any discussion? Seeing none, I'll call the question. All in favor?
Oh, I want to thank both the landowner and the crew that's doing the construction for bringing this forward and going through the steps, proper steps. We really appreciate it when it's done the right way. So I just want to commend them for doing that. Thank you.
Thank you, Councillor Duck. I'll call the question. Those in favor? Carries unanimous. And we're moving on to staff reports, and we're under 13A, which is development of a tenant protection bylaw for Sydney. I'll turn to our Director of Community Planning, Mr. Newcomb. Good evening.
Good evening. Thank you, Mr. Mayor. So this report details a proposed approach to the development of a tenant protection bylaw in Sydney, one which would strive to balance support for displaced tenants due to redevelopment with the resources that are available at current staffing levels. This is a relatively new area with enabling legislation only being adopted in 2024. Prior to that, the town, like many other municipalities, attempted to address tenant displacement through a policy approach with varying levels of success. Although the province has the power to deliver tenant assistance directly through the already existing Residential Tenancy Act, they chose instead to defer these powers to individual municipalities. Not only does this download the burden onto local government, it creates a patchwork approach to tenant assistance across BC and requires more resources from local governments, even to simply research and consider a bylaw, let alone implementation. A tenant protection bylaw provides statutory authority to local governments to ensure that displaced tenants are provided with a increased level of assistance, and as such is readily enforceable by the municipality with standard bylaw enforcement tools. On the positive side, it provides predictability for all parties, enforceability, a structured approach and process, and financial certainty for all involved. It is a tool that can help the most vulnerable in our society, but it is also a blunt tool that generally treats all tenants the same, regardless of income, means, or capability. It also places the town in the middle of a potential contentious relationship between landlords and tenants. Based on the report conducted by the town's consultant, feedback from colleagues at other municipalities, and staff's past experience with the tenant assistance policy, staff have significant concerns with the required level of staff time, resources, and specialized knowledge that would be required to implement a comprehensive approach to a tenant protection bylaw. Many aspects of a tenant protection bylaw are essentially a kind of social services in nature, and these services require significant time and knowledge to fully deliver. These resources currently do not exist in the town hall. As a result, staff are proposing a more modest approach to a tenant protection bylaw, one that would focus on requiring the property owner to communicate with tenants and provide financial compensation and moving assistance, while not including more resource-intensive aspects, such as a right of first refusal for new units, rehousing services, or rent top-ups during displacement. Staff believe that this approach, if applied to only the 8 older purpose-built rental buildings in Sydney, would be a manageable approach that could be accommodated within existing staff resource levels, assuming there is no significant increase in redevelopment activity. Thank you, and I'm happy to answer any questions.
Thanks, Mr. Newcomb. I'll turn to colleagues for any questions. I'll begin with Councillor O'Keefe.
Thank you. Through you to staff. Thanks for the responses to questions late this afternoon. Sorry about that. But I'm just wondering if you can help me kind of walk through the process in terms of when this would kick in. And so what I remember from the 3rd Street example, I recall, I think the developer owner came in and gave notice to people. And then they contacted the town to say, hey, are we protected? And we couldn't protect them because I guess they hadn't submitted a formal development permit or application. So I'm wondering, in this circumstance with setting up development permit areas, and knowing that before they give notice to a tenant under the RTA, they have to have demolition permit. So is that when the kick in of the bylaw would take place, when they applied for the development permit, or I just need some help kind of navigating how that would all roll out.
Sure, yeah. So through the mayor to Councillor O'Keefe. First of all, I just want to be clear that all that staff are proposing tonight is a potential approach to how we could put a draft bylaw together. The details of that bylaw would still need to be hashed out, and we would bring that forward for council's review at that time.
Okay.
In terms of the previous situation on Third Street, to my understanding, no notices to end tenancies were issued prior to the demolition permit being issued by the town. What happened there was that the developer offered the tenants a level of compensation if they would voluntarily agree to leave the building.
Okay.
I believe in all but 2 of the tenants' cases that was essentially what happened. The 2 tenants who chose to stay, they were not given notice until the demolition permit was in hand by the property owner. So they did follow that sort of established procedure under the Tenancy Act. And I think even with the draft tenant protection bylaw, a tenant protection bylaw being adopted, it would be very much the same process. The difference is that with the tenant protection bylaw in place, the town would not be obligated to issue a development permit until the development permit for tenant protection is issued. So until we see that the bylaw has been satisfied, line by line by line, we can withhold that development permit, which also allows us to withhold the demolition permit. So the process would essentially be the same. We just now would have a mechanism up front to say, you know, no, these things in the bylaw need to be completed before we're able to move to that next step.
Okay.
It wouldn't prevent any property owner from going to a tenant and saying, listen, if you move out voluntarily, I'll give you X number of dollars. That's always an option for, that would just be a mutual agreement between landlord and tenant.
Yeah,
Thank
okay.
you.
So it sounds like we have a bigger stick, so to speak, this time in terms of something to get them to, the developer to comply, that we're have that ability to withhold.
Yeah, that's right. It's just a legislative tool to allow
Yeah,
us to
okay.
hold that demolition permit.
Okay.
Yeah.
And I had a few questions, but most of them I'll leave, I guess, till the bylaw comes forward. But one that I did want to ask about, just because it didn't show up in the recommendations, was incorporating the right of first refusal in the new building. And I understand the rationale, I believe, for why it's not there. It's hard, it would be hard to enforce, and whether it would even be feasible. But I'm wondering, is there any benefit in having that clause in there anyways? Not that it would say that it has to be within 10% of the rent or anything, just sort of a more broadly worded paragraph that allowed current tenants to take up one of those suites if they wanted to. Is that something that might be consideration? And I guess I'm also thinking of that in terms of buildings where we might approve in the future, like the one up on Beacon West, where there was 20% of below market rental units. So in a case where we did enter into some sort of arrangement like that, say if that was the case on Third Street, whether we could put that in as a right of first refusal if there was below market component in what we were approving.
Yeah, so I think I'll go back to what I alluded to in my introduction to the staff report, in that the aspects of a tenant protection bylaw, like right of first refusal, like assistance in finding new units, it sort of sounds simple when you say it, but it's an extremely complex process that is extremely time consuming, and essentially puts staff in the position of acting on a tenant's behalf to secure a new rental unit. We haven't done that here in Sydney, but in speaking to colleagues at other municipalities, that is a full-time job, if not multiple full-time jobs. And I think my concern is that if we do go down that path, we need to go down that path, all the way in, because that's what it takes. I don't think we have the resources to currently do that here. I would like to see a tenant protection bylaw that's clear that, that we don't provide that service, or we do provide that service. The current policy, which does allude to wanting that as something for tenants' benefit, what we've found is that when we've brought that up with developers in non-rezoning situations, so they're not obligated to follow the policy at all, but we bring it to their attention to say, you know, if you're willing, we'd like you to look at this policy and perhaps follow some of its tenets. There's no interest in that type of activity specifically. And I think, you know, and it's another reason why I don't think the province has gone there with this type of activity, is because it's an extremely difficult and labor-intensive process. And, you know, my recommendation would be that we don't include anything like that. Of course, council's decision, but yeah, I wouldn't propose that in the bylaw.
Yeah, okay, that's good. That's all. Thanks for me.
Thanks, Councillor O'Keefe. I have next Councillor Councillor Novick and Councillor Duck.
Thank
Sorry.
you, Mayor.
Turn it to Mr. Edwards, sorry.
Yeah, thank you, Mayor. I did want to just make an observation that, you know, we just had a presentation from a healthcare clinic, essentially advocating for support from the municipality for a provincial service. And now we're reviewing a potential bylaw or direction to draft bylaw to essentially provide what is currently a provincial service. And so I just want to echo our Director of Planning's comments that we simply don't have the resources to take on this level of service in the same way that larger municipalities do. And even when we look to a city the size of Kelowna, they have made the conscious decision to pull back on some of the provisions of their bylaw. And so I would just say that we have to be really honest with our capacity, and that's what we're trying to share with you tonight is while we're willing to take this type of work on, we need the appropriate levels of resourcing to support that.
Thanks, Mr. Edwards. Councillor Novick.
Thank you, Mayor. And Mr. Edwards kind of stole my words right out of my mouth. My big concern about this is, again, the downloading of provincial responsibilities to us.
Yeah,
But
we're at the point of questions.
my question is, do you feel this is something that, if we do take it on, is going to create a conflict or could create conflict with the Residential Tenancy Act?
Through the Mayor to Councillor Novick. No, it's pretty clear in the legislation that, so this is on top of the requirements of the Residential Tenancy Act, but doesn't duplicate it. So that the month of, so you're in the act, you're required to give 4 months notice, and one of those months, you need to reimburse the renter, just not charge rent essentially. So you can't double dip from that perspective, but it would be on top of what the Tenancy Act requires, and the legislation is written in such a way so that they work together. The challenge, I think, in Sydney, another challenge is that we don't have, you know, compared to a city like Burnaby that has hundreds of purpose-built rental buildings, many of them quite old, Sydney only has 8 older purpose-built rental buildings left in the community. So the frequency of those being redeveloped is unknown, but we could surmise that one might get redeveloped every 3 to 5 years potentially. That's kind of what we've seen to date. The buildings are aging out. They range from late 60s now to 1985. The frequency of that redevelopment, on the flip side, is not frequent enough to have a full-time staff person doing it. There would be years where they'd have nothing to do essentially. And so it's a very difficult position to be in, because we've got, you know, potentially this big rush of work if we went all in with the tenant protection bylaw. And at the same time, you know, that work's not frequent enough to justify that full-time position. Again, you know, it's having been exposed to this a little bit with the 3rd Street development recently, and then speaking with colleagues in other municipalities that have sort of quote-unquote all-in tenant protection approaches, it's essentially, in Burnaby's case, it's multiple full-time positions just dealing with this type of thing. So it is very labor-intensive.
Thank you, Mayor.
Thank you, Councillor. Councillor Duck and myself.
And just to be clear, question through to staff, thank you, Mayor, is just, this is for redevelopment of existing purpose-built rentals. Just to be very clear that we're not talking about, some units have a combination of owned and rental properties, but it's those purpose-built rentals.
Through the mayor to Councillor Duck, in the case of the approach that staff is proposing in the report, what staff are proposing is those 8 specific purpose-built rental buildings. They're all rental. They're all sort of 60s to 80s, older 3-story walk-up type of buildings. Just those buildings. No mix of tenure or anything like that.
Thank you, Mayor.
Thank you, Councillor Duck. And actually, you asked a question that I was going to ask. That is whether it was the 8 or 14 properties. And so the age of the 6 buildings, other than the 8 older ones, I think it was in the staff report.
Yeah, it's generally alluded to in the staff report, but it's 1968, 62, 68, 69, 78, 79, 79, 80, and 85 are the years of the buildings.
Sorry, of the 8 or of the 14?
Sorry, of the 8.
And so we're not including the other 6 in the RM6R zone because of their more recent age?
That's correct, yeah.
Okay, thank you. Just want to go back to part of Councillor O'Keefe's question with regards to the trigger for either the policy or a bylaw. And so the current trigger is a rezoning application under the policy?
So the way the current system works is that we have a policy. We ask developers to comply with the policy in the context of a rezoning application. Developers may or may not comply with the policy, and council has the power to consider the degree to which developers have complied with the policy in making their decision on rezoning.
Yeah, no, I appreciate that, but the trigger is us becoming aware of a rezoning application, or the
That's
submission
correct.
of rezoning
Yeah,
application.
yeah.
And the trigger under a possible new tenant protection bylaw would be just a development application.
So the properties, if it were those 8 properties, or whatever properties were included in a development permit area, so the OCP would need to be amended so that the properties we want to include are in a development permit area for tenant protection, essentially. If a developer came in and applied for a demolition permit and was intending to, say, use that demolition permit to go to their tenants and say, I've got my permits in hand, I'm going to demolish the building, here's your 4 months notice. If the property is in that development permit area and the property owner applied for a demolition permit, prior to being able to issue that permit, they would need to have a development permit for tenant protection issued and approved, and then that demolition permit could be approved.
No, thank you for the clarification.
Yeah.
So the trigger could be, if the first application was a demolition permit, the trigger would be
Yes,
the demolition
yeah,
permit.
essentially.
If the first application was a development permit, it would be a development permit.
Yeah.
So I just wasn't
Yeah,
clear
if
on that.
if the first application was a demolition permit, we send them back to the development permit stage, essentially.
Okay, fair enough. Thank you very much. So, Councillor Duck,
I'm prepared to move forward with the recommendation.
if there are no other questions, please go ahead.
And I so move that that staff bring forward an amendment to the official community plan bylaw number 2240 to add a tenant protection development permit area for purpose-built rental properties within the RM6-R zone built in 1985 or earlier. And 2, that staff bring forward a draft tenant protection bylaw for consideration, which includes the following components: A, a level of direct monetary compensation for tenants; B, monetary compensation for moving expenses; C, a requirement for property owner / developer to communicate the end of tenancy process to affected tenants; and D, a requirement for the property owner / developer to report out to the town on compliance with the tenant protection bylaw.
We have it moved. Do we have a seconder?
Second.
Councillor O'Keefe, turn to the movers.
Yeah, I'm happy to see this come forward because it certainly will, I think, as one of my colleagues said, give us more direction on how we can help with tenants. And the other part, we certainly have experience in past developments, some concerns with how that was handled, although it was on both sides worked out, I think, all well. I want to clarify, as the staff has said, this is not a replacement for the RTA, the Rental Tenancy Act, and it is only applying to specific properties and their purpose-built rentals. And I think it's important that the town indicate that its role here is only in the new or redevelopment of areas, not in relative extension to other tenant protection activities that the RTA does. Because I think it's a delicate line that this is now coming down from the province, and I think we've got to be very careful here that we don't get in too far into what is none of our business, really. Thank you.
Thank you, Councillor Duck. Councillor O'Keefe, please.
Nothing to add.
Councillor Garnett.
Yeah, thank you, Mayor. Yeah, I originally had come to the meeting with the right of first refusal, thinking it needed to be part of the policy. I really appreciate what staff's done on this. The policy we currently have is one that I brought forward in 2019, and as many who are here can remember, it was in sort of reaction to the Argyle being taken down, which was a 12-unit, two-story below market rental just to the east of here, where now stands a 4-unit condo or 4-floor condo building. And back in that time, there was basically all there was the RTA, so it was a difficult situation. You make a lot of sense in what you're saying, and it's unfortunate that we're again having things that are not in our purview from the province kind of handed down to us. Unfortunately, senior levels of government are letting things fall through the cracks, and we're kind of the last landing pad, so to speak. But where I do worry is that the report clearly indicates that there's a very low likelihood that these individuals will be able to find another housing situation in Sydney. And when I was thinking about that, I was thinking what we're, not us per se, but what the process is effectively forcing these individuals to leave their community. And I think what's lost on that is the social and familial connections that people have. They may have childcare here if they have kids, their kids go to school. They probably have a job here, and they may even have, ironically enough, a primary care provider in the community and so you have to make a decision. It's an impossible decision. Do you move somewhere else where you can find affordable housing, or what do you do? And I think to the young woman who bravely spoke at our public hearing at the Wakefield Manor, who lives in her vehicle because she couldn't afford her rent, and she works here, and she has a daughter here, and she doesn't want to leave the community. And it pains me to think that there's going to be people in that situation. Is that going to add to the people that we're going to have at our warming shelters and our warming centers, which again is something that's coming down from the provincial government. But as a community, we want to be able to provide and what we can for the most vulnerable, even though it's not in our purview, because it's the right thing to do. It's the morally right thing to do. I think if this bylaw, if nothing else, will add, what I've written in my report is it adds teeth to what we had before. We now have parameters that are going to be a requirement, not just necessarily a suggestion, basically. So I'm hopeful that, as we move forward and these buildings are redeveloped, that this policy will help, certainly more than what happened before. When the policy came in, we didn't know, and then of course it wasn't used until just recently for the first time, and then that's when you see the gaps, that until it actually has to be put into play. So once again, I just really appreciate the work staff has done, and this is a very difficult, for people who might be watching this later, it's a very difficult thing to try and manage, keeping in mind that these are human beings. We often refer to tenants or individuals, but these are people whose lives are going to be, they're going to go through a major upheaval. So we'll try and create a bylaw that is cognizant of the fact that we're trying to help people that are going through desperate times. Thank you, Mayor.
Thank you, Councillor. Councillor Novick, please.
Thank you, Mayor. I'm going to vote against this. I don't think that this is the right type of legislation for us. Again, I think this is a downloading of provincial responsibility to municipalities. It adds a significant layer of complexity to the work that we have to do in managing our community. I note that it only applies to buildings that were built prior to 1985. And as Mr. Newcomb said, that there's only 8 or 10 small number of buildings that are going to be affected. Yet we do have a number of purpose-built rentals that are coming on stream at 2180 Beacon and what is it, 2044 or 2144 Beacon. We're looking at over 300 units and more coming on stream with the High Street property and probably a few others in the coming years. So we're not doing anything to address those rentals, those purpose-built rentals now. I'm wondering if perhaps maybe we're thinking we're just going to leave this for a future council to decide. I mean, if we're going to do it, why not do it for all time? I'm not satisfied that the provincial government couldn't do something that would take this out of our hands. The Residential Tenancy Act is a big piece of legislation. I've had lots of experience with it. It works well when it needs to work well, and I don't see why that piece of legislation couldn't be amended to deal with better tenant protection. Why does it have to be downloaded to municipal governments where we don't have the staff, we don't have the expertise to deal with this? I just think it's wrong. I feel that if we need to do anything at all, it should perhaps be a revision of the policy to maybe tighten it up a little bit, but to create a legislative framework that we're then going to be responsible for enforcing. And again, enforcing only for a very small number of buildings, I think it's wrong. I think it's a waste of our time. I think it's a waste of legislative energy. I think it's a waste of staff time. With all due respect to the work that they've put into this, they put a lot of work into it. It's a great report, and the report from the third party, from the consultants, all that is what's convinced me that this is not something that we should be doing, that it is something that's better left to a higher level of government where this initial responsibility lies with in the first place. I worry that it's a thin edge of the wedge, that when the government, excuse me, when the provincial government sees municipalities taking these steps, they're going to say, wow, great, more responsibility taken away from us. Let's throw a little more in that direction. And it's sort of the death by 1,000 cuts that these little bits of work are continually being added onto our plate. We don't have the tax base to support it. We struggle every year as budget comes up trying to keep our tax increases to a reasonable level. And these projects, even though they may seem innocuous, simply add to our administrative burden. And I just can't support it. Thank you.
Thank you, Councillor Novick. I have next Councillor O'Keefe.
Thanks.
Or sorry, you're speaking for a second time? Yes,
Kind
you
of.
yeah,
I didn't
you-
really speak the first time, but
I think you did pass the first time, so go ahead.
thank you. Just a couple things I want to mention in terms of administrative burden. Yeah, it kind of is. However, from what I see here is that I think this will be less onerous than the policy that we had, because the bylaw seems to have more teeth, and so less, from that perspective, maybe a tiny bit more easier to implement. The one thing I just wanted to bring to staff's awareness is about my concern about seniors who I think are, likely to be impacted by this in the future. And I know that we haven't incorporated that component in terms of the developer helping people find a place. But I'm wondering if that, despite that, that we could at least have maybe some sort of relationship or communication with the Shoal Center, who recently set up a housing navigator for seniors. And the reason I'm saying that is at a session that they held last year, they talked about the number of seniors that were being displaced from older buildings like this, and the huge amount of stress that they go through trying to find a place. So they're usually not equipped to know, okay, where do you go to find a place? You gotta go on the internet. And whether a lot of them just don't have the knowledge or skills on how to do that. Packing up their place, cleaning up after, and the move. So I know it's not necessarily maybe gonna be a part of our policy, but maybe in the future, if there's a building that's being redeveloped, there might be a way for us to give a heads up to the Shoal Center to say, hey, this is happening here. There might be some seniors impacted. Because I don't know if a lot of seniors would know of that assistance that might be available. So just more of something for us to keep in mind and an FYI, I guess.
Thanks, Councillor Keefe. Mr. Newcomb, please.
Oh, thank you, Mr. Mayor. Sorry to interrupt. I just wanted to add that staff, during the recent use of the tenant assistance policy, staff did refer several of the residents there to both Beacon Community Services and the Shoals Center, who I believe offer those housing relocation services. So we are aware of it. We do get inquiries from time to time as well from residents, and we do respond and refer them to those services. And I just point out that those people have the special skills needed to help those types of people find new housing, to assist them when they're moving, and they do likely do it much better than we as, say, planners could in the town hall.
Mr. Edwards, please.
And following on that too, with our experience working with High Street as well, they did point their tenants to additional resources and other external agencies that could provide support, and there was a dialogue with our staff and High Street staff, and with that communication as well. So I think those types of dialogue and supports will still be provided going forward.
Thanks, Councillor Keefe. So I have a question before I start my motivation, just to confirm with staff that the trigger under the current RTA is a demolition permit, pursuing a demolition permit. It's not our bylaw. I'm talking about the provincial RTA.
So under the Residential Tenancy Act, yes, what it says is in order to give notice to tenants,
Yep.
You need to have, it doesn't specify a demolition permit, it just says all the necessary permits in place and intend in good faith to demolish or redevelop the rental unit or something like that.
Okay.
Yeah.
No, thank you for that. So I'm very much in support of this. As outlined at near the beginning of Mr. Newcomb's report, it was in 2024 that the provincial government passed Bill 16, which empowers local governments to enact tenant protection bylaws. The provincial government was signaling there they are not going to take on any further responsibility for tenant protections, yet they're providing the legislation to the municipalities. So it does become a matter of, are you going to accept a downloading or not? And as recommended by staff in terms of the approach taking forward, providing the additional assistance and moving expenses can be very significant, as we saw in the High Street example, to tenants. Certainly you would want the province or even us to consider going further with right of first refusal, but as we heard from the previous application, that on principle they weren't willing to provide right of first refusal because it then increased the cost to the other residents. Well, you actually have a slippery slope. What if you have a 40-unit building and all 40 tenants want right of first refusal. Well, is the project financially viable? So it's very difficult. It's very cumbersome and staff resource intensive to actually administer. But in principle, there can be challenges with that. So I think we're taking a very measured approach in terms of trying to increase the assistance. I like that this policy would dovetail in terms of application. In essence, a developer needs the necessary permits, a demolition permit to be able to give notice to tenants, and that would trigger our tenant assistance bylaw if we go that way. And so those additional benefits would kick in. So I think it removes, a potential loophole that existed, previously to provide this. So thank you, staff, for doing this, and I thank staff also for the examples such as the Kelowna example. When you see much larger jurisdictions in the province struggling with this and at what level they can take on these services as well, I think it helps provide guidance to us as a much smaller municipality. Not seeing any further discussion, I'll call the question. Those in favor? Opposed? Councillor Novick is opposed. The motion carries. Okay, we'll turn to our next item, which is item 13B, which is a contract award for a pump station. I see Mr. Murphy online. Good evening, Mr. Murphy. I'll turn the floor to you.
Good evening, Mayor and Council. So yes, this is contract award for the detailed engineering design for the Harbour Road Pump Station Replacement Project. So the Harbour Road Pump Station is an important part of the sewer system and serves over 400 properties. It is unfortunately reaching the end of its operating life, and having stuck my head inside it myself, I can tell you that it is very much approaching the end of its operational life, so we have to plan for its eventual sooner or later replacement. And so condition assessments have been done and conceptual design has been done previously, and the conceptual design suggests that constructing a new pump station across the road, across the street, is the best way to go. And that also allows the existing pump station to keep operating until the new one is fully ready to go. So step one is to do the detailed engineering design. So all of the civil and mechanical and structural and electrical design work. And so we put out an RFP to the engineering firms. We received 9 submissions, lots of high quality submissions, and the one that is the highest ranked is for Stantec, and so we'd like to recommend award of the engineering design contract to Stantec. And this will be for part 1, which would go as far as the tender process, but we won't proceed to tender until we have confirmed capital funds to actually do the project. So currently there is a grant application that's out to actually construct the new pump station. We checked today and there's still no word back on that, but we do have funds in the 2026 budget to do the engineering design. So we recommend moving forward with that as per the recommendation here. And then as we get into the 2027 budget process, we'll have a better sense of whether the grant was successful or whether we will need to start looking at other funding options to actually construct the pump station. But that's not a decision we have to make today. So we just recommend going forward with the engineering design at this time.
Thanks, Mr. Murphy. I'll turn to colleagues if there's any questions. I'll start with Councillor Duncan.
Thank you. Just a brief question. Which other side of the street? The other side of Resthaven or the other side of Harbour on the corner?
Through the mayor to Councillor Duncan, so the other side of Harbour.
Okay.
Still at the corner with Resthaven. Will require a little bit of reconfiguration of the intersection of Harbour with Resthaven, just to create the proper angles. But that will be part of the design process here and is nothing overly significant.
Okay, so I follow up if I may.
Yeah.
So is that all within the town's right of way then that's on that corner?
Yes.
Okay, thank you.
Councillor Duck?
Yes, just to follow up if I may, Mayor. With respect to that, how does that impact the business at that corner, the little convenience store there?
Through the mayor to Councillor Duck, so no impact in terms of the space they're utilizing. No impact to the parking in front of them. There will obviously be impacts during construction, particularly when when connections are made to the existing station and when the existing station is decommissioned, but that would be a relatively short duration of the overall construction. So other than having construction nearby, and there will still be full traffic access in and around the area. And in fact, there might be some small benefit to having the pump station move across the road ultimately for them.
Well done. Thank you.
Thank you. Seeing no other questions, turn to someone to move the recommendation. Councillor Duff?
Okay, I so move that the recommendation that RFP 2025-11 Harbor Road Pump Station Replacement Detailed Engineering Design be awarded to Stantec Consulting Limited for the contract amount of $92,525 plus optional work in the amount of $28,855 plus applicable taxes plus contingency for scope changes as outlined in the staff report dated March 23rd, 2026.
Second?
I'll turn to the movers.
Nothing to add.
Any other discussion? Seeing none, I'll call the question. Those in favor? That carries unanimous. Thank you, Mr. Murphy. We're moving on to 14. We have two items. 14A is the CRD bylaw regarding the Traffic Safety Commission. Being a member of the CRD board, I'd be happy to ask any questions prior to considering the recommendation, if you wish. Councillor Gurnett.
Thank you, Mayor. With regards to the Sarah Beckett Memorial Scholarship, it's not clear in here. Is this the $16,000 that's been donated? Do they still accept donations, or is that just what was donated at the time and that's what they have to work with?
I'm sorry, I don't know the answer to that question. Yeah.
A little fine in the details. I get and when it says they'd be looking at exploring options to delegate the scholarship nomination and selection, do they anticipate that those particular parameters would be done so there'd be no delay in awarding of the scholarship?
Yeah, the intention is to try to continue that particular scholarship.
Okay, and the last question I have with regards to the $76,982 for the traffic study function that's going to be transferred to the transportation safety budget. So will that amount of money be amalgamated into their general budget, or will it be still kept for those specific traffic safety functions that the money was originally intended for?
So it's a great question, and it was asked around the table, around the board table. And so the process that the CRD is in now with regards to the new transportation service is staff are working on the new regional transportation plan. That new plan won't come forward until 2027. And so a lot of those answers to those question and answers will come forward at that time. So the Traffic Safety Commission has been established for, I'm not sure if it has it in the report there, but it was some 30 years or longer. I served as the chair of it for 2 years. You know, it had a relatively small budget at about $75,000 a year, but it had a you know, a solid mandate with a lot of participation from around the region. And so through the new governance structure, if you will, and the new transportation service, and the regional transportation plan, it would look to continue as, you know, some of the good work that was done by that commission.
Thank you.
You're welcome. Okay, if I could look to someone to move the recommendation that staff have provided, please. Councillor Duncan.
I move that council consent to the CRD adopting bylaw number 4719, Traffic Safety Commission Establishment Bylaw number 1, 1990, amendment number 5, 2025.
Second.
Moved and seconded. Any discussion?
No.
Seeing none, I'll call a question. Those in favor? That carries unanimous. Thank you. And now we're turning to 14B, which was item 15.2 that Councillor Gannett raised. I'll turn to you, Councillor.
Thank you, Mayor. I thought we should bring this forward because there's consistency in the three different letter writers and what their approach was, and there was mention. I thought it was important to discuss because they mentioned the OCP in relation to the small-scale multi-unit housing Bill 44 legislation, and we adopted our OCP in 2022, and we were required to incorporate the SSMUH into our zoning bylaw by December 31st, 2024. And so there was a specific exemption given to municipalities in the Local Government Act from these changes being consistent with the OCP. So this will be adjusted moving forward, probably towards the 2030 OCP review. But I think it's important to note that through the process, staff did a pretty good job of nuancing the zoning bylaw to as best they could, given the legislative requirements, specifically around setbacks, which this particular development will have to adhere to, or else be requesting variances. And while I agree that the blanket approach of the bylaw, of what the province brought forward is, and this is an example, and there's been a few, where it's a little bit problematic. One being that it doesn't allow for green space and trees in a lot of areas. It densifies to the point where you don't have a lot of room for anything else. But in this particular context, it kind of takes away the ability of the community and staff and council to consider the neighborhood context, as the letter writers were referring to. The scale and design of the proposed building is consistent with the province's guideline for the small-scale multi-unit housing, and 3 stories are permitted, and I think it's within the height as well. And but it is, as the letter writers contend, a pretty big change to that neighborhood if you go out there. I mean, it's just an empty lot right now. But in terms of what the houses look like in that particular area, being so close to Roberts Bay, this is where it would have been nice to be able to have your local government and the community weigh in on what they want it to look like. But it's a legislative requirement that we need to follow, and staff has done a good job in their response letters as to why this, what the approach is that's been taken. But I just wanted the letter writers to know that in terms of the OCP, why it does not align right now is because it's not required to, but it will in the future. Thank you, Mayor.
Thank you, Councillor. Any further discussion? Councillor Duck, please.
Yeah, I was appreciating this being brought up by Councillor Garnett, but just if I can, a couple of questions through to staff on it. And having looked at I pass by this property on a daily basis and watched the building that was there before, which was about 1.5 stories relative to the 3 stories that's going in there, and the house behind it, which sits on Roberts Bay, which is currently a 2-story house. And I'm just wondering, relative to what they show on the land in terms of survey tape, shows the house that's going to be constructed fairly close to the back setbacks. And I'm wondering, within those setbacks, if and appreciation of the neighbors, if that house can be moved closer to the roadside, as one thought. And just wondered if that's in consideration.
Mr. Newcomb?
Through the mayor to Councillor Duck. Yeah, so the setbacks for that zone, I believe, are 4.5 meters or 15 feet in the front and 4.5 meters or 15 feet in the back. In the back, then the panhandle lot's front setback would also add to the distance between the 2 buildings. The project isn't required to, all they're required to do is meet the setback requirement. Typically, the town won't request that someone site their building in a certain location. They have the right to site the building where they like to within those setbacks. If they want to go closer to the property line, there's the variance process, but there's no flip side process to that. So typically, that's not something that we'd discuss with the property owner.
Thank you, staff. And further to that, so currently within the existing OCP zoning and building codes, it meets all those requirements.
Yeah, to my understanding, the application just came in several days ago, so I don't believe that staff have had time to sort of look into the building code or zoning compliance things in a ton of detail yet, but that's obviously part of the process, and so the permit won't go out until those things are satisfied.
Thank you, staff. And just a follow-up on, there was one letter that was talking about the shading impact of the building, and having gone by there today, I think there are 3 or 4 existing trees that were currently providing that shade, and I don't think it'll be much different once there's a building there. So I think that, you know, as the staff work through this, it's just, you know, as Councillor Garnett has pointed out, it's one of those things we have to adapt the neighborhood relative to the provincial housing bylaw and work within it. Thank you.
Thank you, Councillor. So we'll now move to the next item, which is under 15. We have the two other pieces of correspondence that are being received on our agenda this evening. Don't require a motion, so we're turning to number 17, motion to go on camera. I'll turn to Councillor Garnett, please.
Thank you, Mayor. I realized I have to flip over the page to get the last bit of it. I'll move that it is in the opinion of council that the public interest requires that persons other than members of the council and officers be excluded from the meeting to consider confidential matters regarding potential litigation pursuant to section 90.1G of the community charter, and that council continue the meeting in closed session.
Second.
Moved and seconded. All in favor? Thank you. We'll just pause for a few minutes to reconvene.